Try not to adjust things. Hi, my name is Miss Newlove and I'm one of the hosts of a brand new show brought to you by Bestel Foundation. The Wellbeing Show is to help reach BAME families, to help with mental health, support and emotional needs. The Wellbeing Show streams live every Tuesday at 8 to 9 p.m. on Diversity Radio via Facebook, YouTube and Mixcloud. So tell your family and friends to tune in as we discuss topics that affect our well-being. The Wellbeing Show is proudly sponsored by NHS South London and Maudsley, the National Lottery Community Fund, and partnered with Real Insight, Base, 60 Seconds Creative Studio, and Gold Diggers Talk Show. Good evening, everyone, and welcome to Bestel Foundation's The Wellbeing Show. Today's Tuesday, the 6th of December, and our topic today is quite an interesting one: reproductive health conditions that affect fertility. And we have a guest on the show, a lovely lady called Elizabeth Amoaa, who's a reproductive health advocate and an author. And you're going to find out why she's amazing and why she's a special lady today. As usual, I have my amazing co-host, Miss Jacqueline Obeng, who is the CEO of Base and also a teacher of business and economics. Jacqui will be with us shortly, but just before she comes on, as usual, a big thank you to our sponsors who are South London and Maudsley NHS Trust, the National Lottery Community Fund. Our partners are 60 Seconds Creative Studio, Diversity Radio. We're streaming on Diversity Live right now. Gold Diggers Talk Show, which belongs to myself. Base, Become a Successful Entrepreneur, which belongs to our very own Miss Jacqueline Obeng. And also Real Insight, that's it, Real Insight Consultant, which belongs to Nash. She's also a part of Bestel Foundation and does amazing work with them. So as I said, I have Jacqui and she's here with me today. And she's going to be, my partner in crime as we go through this topic, which is quite sensitive, but don't see it as something that's scary. See it as awareness, like all our other shows. And I hope that it touches someone today and, it might help or lead someone in the right direction. So Jacqui, are you with us?
Yes. How are you?
I'm fine. I'm fine, just trying to adjust to this crazy cold weather. I heard it's going to snow this week.
Yeah, it's actually biting cold. The first time I had to obviously scrape off a cup of ice off the car this morning. So it is really dropping. It was probably about, 3 degrees or 4 degrees early this morning. So it is getting very cold. So obviously we need to warm up. A couple of birthdays. Remember Simon Donnelly had his birthday, I think 2 weeks ago. Did you see that? Yeah. So happy belated birthday to Simon. And then our own Enoch had his 18th birthday last Sunday, which was really good. How come we went there? Went to church.
I did go to church myself, but I had a bit of a domestic issue on Sunday. But I did send my wishes.
Okay. Well, it was good. Full of young people. Boisterous party. It was good.
I can imagine.
So happy belated birthday to Enoch. So far so good. It's been quiet. Well, it hasn't been too quiet. 2 weeks ago, I think there's a couple of stuff. It's been quiet in terms of base. But work's been busy. We've got mocks. Been marking a lot of mocks, the 11 and 30 mocks. And we're looking forward to a wonderful Christmas.
Yeah,
anything planned?
Break. I don't have anything planned, to be honest. I just need a break. From, I need a rest, a good
running
rest.
around. exactly.
Yeah.
Well, we all need a break. So we're
Yeah,
looking forward to a quiet, I guess, a quiet Christmas. So
definitely.
back to the Wellbeing Show. Thank you,
Yes.
everybody, for joining, whoever's with us this evening. Obviously, Bestel Child and Adult Psychiatric Foundation is a charitable business registered both here in Ghana. Obviously, in October, we talked about the Mental Health Week, where they've done various workshops in Ghana. Again, we're back here trying to promote the stigma and the awareness within the community. Obviously, you've mentioned some of our stuffing. Obviously, we've got the catering one. Auntie Hilda, she did fabulous beef curry on Sunday. You should have been there. The food was really nice.
You know, I missed out on good food. And I definitely missed out on good food.
The beef curry was really nice. The jollof was very nice. She does all these hot foods, delivering from door to door, including Marion. Fendi was there. Fendi is
Okay.
also part of the mental health team. I think that's it. And I was there. Big Joe obviously didn't show up. I don't know where Big Joe was. So there's a few of us there representing Bestel. Few of us representing Bestel. So this evening, obviously, we've got a fabulous topic, reproductive health. And I thought, oh my God, today is going to be fantastic because we've got Miss Elizabeth Amoaa again. We hosted her last year at the studio. And
Yeah.
tonight she's going to bring us, you know, more insight about our reproductive health and obviously infertility. Obviously, we've got our websites, all the numbers is running across the screen. We've got Stella, who's our CEO, her number is on there. Auntie Christabel, we've got Auntie Hilda, and we've got Marianne. All those are the telephone contacts that you're going to be contacting if you need with Bestel's Foundation services. We also have the website, bestelfoundation.org. Facebook, the social media pages got Bestel Foundation. Instagram is Bestel Calf, and then Twitter, which is Bestel Calf. So feel free to follow us on social media and also share our program. We've got a wonderful topic this evening.
Yeah, I think this topic is going to need a part 2 and 3. But yeah, so today, like I said, we're talking about reproductive health conditions that affect fertility.
Yeah.
So first of all, let's define what reproductive health is. So reproductive health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. In all matters relating to the reproductive system and to its functions and processes. Reproductive health implies that people are able to have a satisfying and safe sex life, and that they have the capability to reproduce and the freedom to decide if, when, and how often to do so. So that's the definition of reproductive health.
Right. So according to the World Health Organization, being a woman has implications with your health, basically. So the health needs women can be broadly classified under 4 categories. Therefore, the first women have specific health needs related to sexual and reproductive functions. So the first part is the sexual and the reproductive function. Secondly, women have an elaborate reproductive system that is vulnerable to dysfunction or diseases, even before it's put into function or after it has been put out of function. And thirdly, women are subject to the same disease of the other body system that can affect men, which is quite interesting. So the disease patterns often differ from the men because of their genetic constitution, hormonal environment, or gender evolved lifestyle behavior. So disease of other body systems or treatments may interact with conditions or the reproductive systems or their functions. So all of these to do with either sexual behaviors, reproduction, and also body systems, basically.
Yeah.
Lastly, because of who women are, they are subject to social diseases, which impact on their physical, mental, and social health, basically. So it's all evolving about how you think, socially or mentally, which have an impact on the body.
Yes.
Yeah. So it impacts on the reproductive health of your body, basically, I should put it. Again, fertility definition is a person's ability to conceive or have children. In general, when a woman is unable to get pregnant, even after at least a year of unprotected sex, she is considered to have an infertility, or her doctor will be evaluating the possible causes. So what's making me laugh is this unprotected sex for a whole year and you're not getting pregnant. It's not funny, but obviously there's a problem there.
Yes,
Okay.
definitely.
Right.
So yeah, so we're going to be speaking to Elizabeth, who's going to give us some insight on all this.
Insight, exactly.
Yeah, there's so many reasons why women suffer from reproductive health issues, like you were just saying. But today we're just going to focus on three common ones, or the three that might sound familiar to us as Black women, or women from the ethnic BAME backgrounds. These are the ones that are quite, we've heard about them, but maybe we don't know exactly what they are. So there's many different conditions that affect fertility. And like I said, we probably need a part 2, part 3 later on in the year, or whatever.
Exactly, to go into details about this, really, because this would be just a holistic overview of how the reproductive affect infertility, right?
Yeah, it's not it's a bit, yes, it's a little bit, but we're just going to focus on the three ones, like I said, that might sound familiar to us, or we've heard, or we know someone who has it, or just the main three that are quite common in Black women. So the first one is endometriosis. The second one is polycystic ovary syndrome. And the third one is uterine fibroids, which fibroids is quite a popular one. So we'll start off with endometriosis. The symptoms of endometriosis can vary. Some women are badly affected, while others might not have any noticeable syndromes. So some common symptoms of endometriosis are pain in your lower tummy or back, pelvic pain, which usually gets worse during your period. When I was reading over these, a lot of the symptoms interrelate, from different conditions. That's what I noticed. So you might hear something from endometriosis, and then you might hear something from fibroids, but they're quite similar. So period pains that stop you from doing normal activities. So there's different levels of pain. Sometimes you can handle, it's like you have cramps, but there are cases where people can't even get out of bed when they're on their period. So pain during and after sex. So if you're having a lot of pain during sex or after sex, that's another symptom. Pain when you're having a pee or you're pooing during your period. So when you're on your period and you're in pain whilst you're pooing or you're weeing, pooing, peeing. Yeah, during your period, that's another symptom. Feeling sick, constipated, having diarrhea or blood in your pee or poo during your period, and difficulty getting pregnant. So these are the main symptoms of endometriosis, according to the NHS.
Yeah.
You may also have extremely heavy periods where you bleed through your clothes.
Wow.
And for some women, having endometriosis can have a big impact on their life and also lead to mental health issues. It can really affect your mental health, because imagine being on your period and then you're bleeding through your clothes. I've heard stories of that happening to people, but to be honest, it's never actually happened to me myself.
Right. Yeah.
So that's quite severe. So we're gonna have a diagram that our technician is gonna put up of what endometriosis might look like. And then We're going to have our guest. We're going to introduce our guest. I haven't even introduced her. I can't just bring her on like that. Elizabeth Amoaa, who's a reproductive health advocate and also author. So much going on with Elizabeth, but we'll talk about that later. But yes, welcome to the Wellbeing Show, Elizabeth.
Thank you. And I love your explanation of endometriosis. I would say you only gave 10% of what the condition is about. It's scarier than what you explained. The pain doesn't only come during your menstrual period. Even when you are ovulating, you can still experience those symptoms. So it is very scary, a very challenging condition that affects women, daily life, lifestyle, career choices. No, you said when people are in your period, they can't walk. Not really. You can be, let's say, 2 weeks post your menstrual period, and you can't even get out of bed, or you can have like a shooting pain all the time around your back or your lower back. Your tummy. Some have leg pains. So it is quite, a very intense. It's a bit more, I would say even more than the explanation that NHS gave, depending on what stages of endometriosis you have.
Okay, so there's different stages of endometriosis.
There is different stages of endometriosis, and each stage have its own symptoms. Like for me, for instance, I am on stage 4, which is the highest stage. So we do have the minimal one, which is stage 1, stage 2. Stage 3 and 4 means it's gone beyond just the pelvic area. So it's gone on, the other parts of the internal organ. Like I have mine on my rectum and on my intestines, so lower bowels. And the moment it go past those levels, that is when you say you're on stage 3 or stage 4. Some people have it around their kidneys, even lungs. Some people around their brains. So it does travel. It is like a scarring of the womb. So it's also seen as, so the lining of the womb that is supposed to be inside is seen outside. So let's say the blood that is supposed to be working within the womb. So it's more like a scarring tissue, as I said, like a sore. Let's just say, like,
and it travels.
It does travels, yes.
So can you just introduce yourself for us? Tell us your background, and let's just carry on with the conversation.
I'm so fascinated, and I love reproductive health topics. So my name is Elizabeth Amoaa. I am a reproductive health advocate. Yes, I'm also the founder of Fertility Awareness. It's a women reproductive health advocacy that raises awareness, or I would say educates people on various types of reproductive health. It's more to encourage women and young girls to seek early diagnosis for any symptoms that they have or signs regarding any reproductive health issues. We also combat menstrual poverty and give education and awareness on menstruation and how to have access to sanitary products. So that's what we do, as my NGO aspects. I am an author, yes, of the book called Unspoken Identity, The Woman with Two Vaginas, which talks about my life and my journey in discovering all my reproductive health advocacy. So yes, that is the little description of who I am, and also the current president of Rotary Global House. So yes.
Oh yes. Congratulations. Really very good. And I heard you just returned back from Ghana.
Yes, I did, yes.
Okay, were you there on work purposes, or was it just a holiday?
No, it wasn't a holiday. I wish. So I went to launch my book, and it was successfully launched. I partnered with Rotary Club of Kumasi. We launched the book, raised some funds, and we also did donations in hospitals and in schools. So yes, still continue to work and raising awareness.
That's fabulous. Very good work that you're doing in Ghana, and promoting, obviously, females or mothers who's going through anything similar. Obviously, we need to change the narrative. So kudos to you. So now tell us about endometriosis.
Eva did a very good job. All of a sudden, oh my God, she's no more a project manager for the council. She's doing it.
Exactly. You've trained her. You've trained her well.
She was right. It is the lining of the womb outside the uterus, and it is a very upsetting condition that now the UK government is paying attention. We've heard it on the news, BBC. There was a huge documentary about it. The reason being is, in the past, people saw it more as a career illness, because I would say many women that cannot conceive, they tend to have endometriosis. The reason being is it's always delayed when in terms of the diagnosis. It takes at least 7-8 years for a woman to have that diagnosis, because people, or I would say medical professionals, were confusing it with a normal abdominal pain or a normal menstrual pains. But these kind of pains is nothing like a normal menstrual pain. This is a pain that you cannot physically do your daily work. A pain that no matter the amount of painkillers you take, it doesn't work. You can have tramadol, codeine, Ridomidol, name it, it's still not enough. A pain that, it starts from the top of your head, it migraine. Kind of exactly. Some people faint. I used to faint, and going down to your whole tummy, your back, lower back, because I have rectal endometriosis. I do get a lot of back, lower back pain around the waist, and these are the symptoms. Some of the symptoms I mentioned as a leg pain. Some people even end up being disabled. Paralyzed because of endometriosis, because of how far they travel, within the bloodstream. So it is a very scary condition that I urge every woman or adolescent out there, if you experience any menstrual period pain or menstrual periods or pre-menstrual pains, you have to get checked, because the earlier the possible. So if it's like a minimal stage, there are some medications or some surgeries that are necessary. Remember, a surgery does not 100% cure endometriosis. It is incurable. So even after surgery, it can still come back.
Yes. So what's the cause of it?
For endometriosis, there is no cause. As many of the pregnancy health conditions, there is no cause. Some people are believed to be born with it. My case, I can only base it on because I have a different anatomy. Because if you have endometriosis, you kind of high prone to have endometriosis. Sometimes we don't know, but sometimes it's the way also the menstrual, let's say the menstrual cycle works within the woman's body. It could also be hormones. So there is not exact cause of endometriosis.
It can be stress.
It can be stress.
Things can bring on reproductive health. I was going to start talking about treatment, but you've spoken a lot about it. They say that there's no cure to endometriosis, and it can be difficult to treat. But the treatments that are available are to ease the symptoms, like you said, the people that suffer from excruciating pain. So treatment can be given to relieve pain, can be given to endometriosis, like you said, sometimes the tissue can be removed to improve fertility and reduce the chance of the condition, So I think you said it all.
I think when they say reduce it from returning, which is not quite right, isn't it? Which is not mine have been picking up by 5 times and it's still there, and it's like travel is still there, and it's new. So
it's quite tricky though. If there's it's quite tricky though. How can one overcome this?
This is the reason why I mentioned that the use of why I mentioned that they have invested. Now they have released a lot of invested. Now more research.
Right.
It looks like there is not enough research. It looks like there are enough cases going on. They want to find out endometriosis. They want to find out immune conditions. Because having endometriosis, you have a very low. You have endometriosis. You have always low. You are tired. Fatigue. Constant fatigue, anxiety, depression, constant. So it is a condition that people are thinking. So having endometriosis that people are thinking can be very scary, because you are more likely to have, let's say, more likely to have the ovarian cyst out with ovarian cancer. So look at how ovarian cancer. So one ovulation, and I pray and believe, and I pray funds that have been released and all the funds awareness are being created and the research are being done now, the research and medical now, because I don't know about other parts of the UK, they are doing, but I hope that there might be a cure, or there might be something there, or the medication, something there about medication, but they should write down the one of them. And it's not right down the shutting down the one, it's not putting you in shutting early is putting that also have early symptoms, that also has its own problems as well.
Well, we're moving on to the other one. We're moving on to the other one. The polycystic with the acronym is with the acronym also a common condition that affects women's own conditions and how they work, women's own and how they work. Irregular periods, ovaries do not release its eggs, ovaries do not release its eggs, excess androgen, high levels of androgen hormones in your high levels of male hormones in your body, which may cause physical facial or body hair, facial or body hair, ovaries, and your ovaries becoming large and releasing, your ovaries becoming large and filling sac fluids, follicles that surround the eggs, follicles that surround the eggs. All of these are symptoms of irregular. All of these are symptoms of irregular periods. So tell us about PCOS. So tell us about PCOS. So PCOS is basically a condition that affects how the ovaries work. Ovaries. Let's say a woman is supposed to ovulate every. My case is quite different. My case is quite different. So maybe every month. So maybe every month female might a female might when you have PCOS, when you have PCOS, you're not irregular. So you will not necessarily have your period every 21 days or 25. However, which it can be very bad to wait. However, which most of these reproductive health, most of these reproductive health symptoms look alike. They kind of some of them have fiber. They look alike. Some of them have fiber. So you have the symptoms kind of irregular. So you have this kind of irregular periods. Doesn't necessarily that you go have PCOS, which is a bit similar. Ovarian is one big, which is a bit similar. Just like one milk, little kind of PCOS are little like PCOS are little like little sacs together full of so PCOS the most common symptoms are PCOS. The most common symptoms I have facial hair. Yeah, when I'm facial hair. Yeah, when I'm I do have facial hair. I don't have PCOS. Yeah, I've had those. I still have some of the symptoms. So of course, I still have some of the symptoms. It looks like you've got the hair lump. It looks like you've got the hair lump. No, I had ovarian cyst. No, I had ovarian cyst. So ovarian cyst. That influences so little cyst. That influences little cyst in the sac. This is like a it's so it's like tiny. So it's like tiny cysts make it so another one called ovarian, and then there's also another one called ovarian. Ovarian cyst is what leads to ovarian cancer, and they can also and they grow in size. They can also disappear on its own. So our symptoms are similar. So as I said, there are some obvious symptoms, but then the obvious symptoms of PCOS are the hair is not working or irregular. The ovaries not working or irregular. Not being able to conceive. Women with PCOS tend to be irritable more among them. That is very common among them as well. And it's very common among black people as well. So it's like Asians, very good. So it's like a virus, very we kind of very into it as well. Make people put on weight. It's always what you can eat. It's always asking what you eat. That eat food that is good for PCOS. And all the conditions that we're talking about, even if you do a simple research, you will notice that there are some food that is not good red meat. Like me, for instance, I don't eat red meat because red meat it cannot make fibers grow. It also doesn't help my metabolism sugar, so I stop eating meat. I don't eat sugar. So there are certain things that which is part of the management that we're talking about. So it's not just treatment. There are management to minimize the symptoms. We talked about all
acne. Obviously, you've talked about thinning hair loss, hair weight gain, excess hair growth, usually on the face, chest, back, or the buttocks. They've got the hairs there. Difficulties getting pregnant as a result of irregular ovulation or no ovulation, and again, irregular periods. So it's quite tricky. So if you have at least any of these two symptoms, then you could be diagnosed with PCOS.
Easily, yes.
Okay, which can affect obviously your reproductive health. Right. Is this common amongst, as you said, the BAME community or other communities? Can you have shared some insight about that?
Well, for me, the women I speak to, mostly, I speak to all sorts, not only blacks. I've noticed that most black, Africans or Asians tend to have the PCOS. I don't know statistically. But
and then you think it's because of what we eat? That's what you said?
Sometimes. It's the, to me, it's the way, it's the lifestyle. And for me, being able to be alive today after everything that I've been through is because I changed my lifestyle. Exactly. So what you eat and what you feed your mind to, you know, if I was basing on the anxiety and the depression, the truth is women with reproductive health have a lot of mental health issues. Yes. And I'm not scared or shy, you know, to say I have had my own fair share. I've had a lot of treatments, you know, which is talking therapy and all that. It's because all these conditions affect your mental health. So what you eat is, it really matters. You need to be careful of what you eat.
Exactly. They also mentioned that, you know, if you've got any of these signs or symptoms, severe symptoms, there's an increased developing health in terms of type 2 diabetes and high cholesterol. Is that why you need to take care of your intake? Obviously, your diet.
Of course, as we mentioned earlier, on one condition can lead to another. So if you don't treat it or you don't minimize the symptoms, it would then end up with others. When I had ovarian cysts, I was told if I don't watch what I eat and take care of myself, I'll have ovarian cancer. And obviously, I didn't want to have ovarian cancer. So I then have to hang on, what can I do to decrease the size of the ovarian cyst? When they diagnosed me, it was 4.5 centimeters. After a year or 2 years, it disappeared.
Right. So is there any age group in particular? So for example, you know, me, I've already had children, so I'm not worried about fertility. So, you know.
Reproductive health is normally from when, you know, I'll say young girls, when they get they reach their puberty. It's mostly, I'll say, from 16 years old, though, because that's when you're ready to be, I would say, a mother or ready to conceive. So normally 16 to the age of 55 when you reach your menopause. So the moment you're in menopause, even endometriosis after menopause, symptoms kind of down. However, if the endometriosis is gone beyond, you know, your womb, which if it's in other parts of your organs, that you will still have the symptoms of endometriosis.
Right. So again, like the endometriosis, did I pronounce it well? It can't be. It can't be cured.
Just the endo.
Is that the shorthand?
Similar to endometriosis, whatever.
Endo.
Is it curable? No.
I don't know any of the reproductive health issues that is curable.
Right. It's not curable, but it's manageable. It's manageable, and therefore, tell us some of, if apart from diet, how can you manage it? Or is it just purely diet?
It's diet and also your mental health, you know, feeding your mind with the right things, you know, the right meditation, you know, relaxing, doing things you love, having a purpose. Because personally, I feel that a lot of the conditions I have overcome or me getting well is because I've taken my time to feed my mind well. And I have like a purpose. The fact that I woke up and then realized that, oh, I am the voice, I am special lady. That alone kind of gives me that joy. And that's what I've noticed. A lot of people with reproductive health, once they have a purpose, once they know that, hang on, they are special, those conditions don't define them. They tend to live well with the condition. They tend to manage. Not only that, it's like even having AIDS, HIV, or, you know, kind of any other conditions. It's mostly mentally. You know, they said in Ghanaian language, you know, so the more you think, the more
you get ill. Exactly. Yeah. Oh, wow. Well, that's really good. You've actually gone through, obviously, advising us that we need to take care of our diet and manage it, as there's no cure
and
to
with
it.
the PCOS, when I was younger, I remember knowing someone who had it, and when they lost a lot of weight, it started to disappear. It didn't go, but their period started to regulate. So they do say with PCOS, it's like weight gain doesn't improve it, and obviously through weight gain is poor diet, and it's not, weight gain is not only from poor diet, but exercising, lack of exercising, these things. So, and another thing that I didn't come across that I know about PCOS is that you sweat a lot.
Oh yeah, you do.
Yeah, like you drip, literally. Like
Not just PCOS, even endometriosis. I do get a lot of hot flashes.
yeah, menopause too. But I know with PCOS, you drip with sweat.
Really?
Yeah, people that have it, they really.
Some of them, yeah, some people do. And the thing is that
what do you mean they are dripping of sweat? They are just sweating all of a sudden.
Okay, when I say like, like not the normal type of sweating, like if you were to go to a party and you get hot, you get a bit, sweaty. Or if you go to a hot country like Ghana, you tend to sweat, but you can manage it. But when you have some people that have PCOS, when they sweat, it's out of their control. It's like out of their control. So they'll just be dripping, uncontrollably sweating, which can, some people find embarrassing to have, because, like when you sweat like that when you're in the gym. You know the way you sweat when you're in the gym?
When you're just, dripping a lot of sweat.
That's what caused that, maybe. But then again, I know some people with PCOS, they don't sweat. That's what I said. All these symptoms, it varies from, patient to patient. I do get a lot of hot flashes for having endo. And you think like, hot flashes, are you in your menopause? I'm not in menopause, but I do get hot flashes. But normally, when you're in your menopause, you get hot flashes. But I do get a lot of hot flashes. So my whole back, from my neck to my waist, can be burning like fire sometimes.
Wow.
Even in winter, it can happen. All of a sudden, it's burning. And I can still be cold. So that's the thing with these symptoms is it's really hard to tell. And I think this is why the doctors always miss it and they don't listen sometimes, because you might be describing some symptoms and they are not very familiar with it. And that's why they have to take their time for you to go through all the possible diagnoses.
It takes a lot of wisdom to diagnose a reproductive health issue, because not only the reproductive health issues, but these symptoms you can find in having cancer. You can find, a lot of these symptoms we've been discussing, they also interrelate with cancer. The same symptoms you get when you have different types of cancers, like bowel, like you have blood in your pee, your poo. So it's like your doctor has to really listen to what you're saying. If your doctor's not listening to what you're saying, they could be thinking you have something else, but really it could be a reproductive health issue, or it could be even something that's not even to do with reproductive health. Something. So it's all about having a GP that understands you as a patient, which a lot of people are complaining about with the NHS now. It's not happening.
It's not happening because nowadays you have to email for an appointment, and they'll call you with a telephone appointment, whereas you need to see the GP face to face. So sometimes it's very tricky. That's why, you have to take care of yourself. And obviously by knowing this knowledge, let's change our diets, to be quite honest.
And I think it's more about persisting. I mean, I am a typical example of someone that the system has, failed me in terms of diagnosis. My diagnosis wasn't done in the UK. I had to go all my way to Germany to get my diagnosis. Although I was seen by many, UK GP. For me, what I learned from that journey is when they said no, or when they were like, oh, there was nothing wrong with you, I believed them.
Right.
Which was the wrong thing. And what I learned through that journey is every symptoms, you have to write it down. And the more you write those things down, when you go to see your GP, you tell them, this is what I'm seeing, this is what I'm facing, this is what I see. Why is it that way? What is happening?
Like when you feel better, you forget about what's happened to you.
And the scan alone is not enough. Having, some of the doctors will just do a normal ultrasound scan. It's not enough. Even transvaginal scan, which is when they insert it through the vagina, it's not enough. That's when you still feel that the symptoms are still there and it's not going. You need to go as far as pushing for MRI, CT scan, even how do you call it? The keyhole surgery. For them to inspect the womb. You need to push and go as far, because that is what I did. And I did it to even find out I have a different womb.
Right.
So this is the thing, and I think this is where
there's a lot of people that don't you know, they can't fight that the way you did, and they're suffering in silence. You know,
and this is why the Parliament, you know, got involved with endometriosis when they did a documentary on BBC, because all these women, thousands of women that came out crying. Some of them have lost their womb. You know, when the endo travels that much, sometimes you have to physically get rid of your womb.
Right. Yeah.
But hysterectomy, that's it. A lot of women.
Yeah, some of the women have to go through that.
Yeah.
And some of them haven't had the opportunity to conceive before. And this is the thing. This is why now, you know, people I mean, when I say the advocates like myself, I say as a woman or a girl, push for the answers.
Yeah.
And you know the truth. Now they listen. Because I last week I was in a hospital. I mean, showing my GP, and I told them, oh, my back pain is coming. Oh, they listen.
Yeah.
Especially when they know you know what you're talking about.
Exactly.
And this is why you said, as Jacqui, you said, write things down. As you said, you mentioned that, oh, persist, eat well, take care of yourself. So you yourself have to take care of yourself. And you yourself have to seek for the answers. And you shouldn't take no for an answer. And you shouldn't think that because they are doctors, they know what they're talking about.
No.
And then you're still experiencing things.
Yeah.
So one thing we'll take from obviously PCOS is about obviously acknowledging that, you know, if you're a certain age and you're looking to have a family, you need to take care of your diet. You know, that's number one. Take care of your diet and obviously your weight. Try and eat, you know, plenty of fruits, vegetables, you know, the 5 a day. Obviously the little bits that make you whole, so that obviously you don't fall into that category of symptoms, which, you know, will be
because what
detrimental.
happens is when you don't do your own research and you don't take care of your health, your reproductive health, you end up relying on medication, which has
which it damages the organs. Exactly, they do damage the organs, and you don't want to get to a certain age where most of your organs will be failing you, and it will become an issue, a whole total different ballgame. So go refer to the GP if you need to be on a diet, or if you can manage your own diet. There's so many dietary recipes online, which you know, you can choose any of those. Normally people like eating porridges, brown rice, lean meat, fish, chicken.
Even dairy, I don't eat dairy. You know, little things like dairy can even increase these kind of symptoms. So
I don't eat dairy either. I just do not eat it at all. And you know, that's not even bread. I can't remember the last time I had bread. So, you know, I'm glad I do not like certain foods, but again, you know, we need to take care of ourselves. So I think, Eva, you're going to move on to the next one.
Yeah. So the next one is uterine fibroids, which is known as fibroids, and it's probably the most common. I mean, when I was young, I always was hearing fibroids in conversations, my mum and her friends, and you know, I think it's the most common condition that we all know about, but I didn't actually really know what it was. I just always used to hear people talking about it. So fibroids are non-cancerous growths that develop in or around the womb, or are known as the uterus. The growths are made up of muscle and fibrous tissue and vary in size. They're sometimes known as uterine myomas, and the other word, I'm not even going to try to pronounce it.
Myomant.
What is it?
Myomant. It's more like German.
Leoyomas.
Because myomas is mostly the Germans. That's how they call it. They don't say myomant.
It's called fibroids.
Yeah, they say myomant. Yeah.
So yeah, many women are unaware that they have fibroids because you don't have any symptoms. Is that true? Well, because you have symptoms of other things, then yeah, but we'll talk about that. So many, like they said, many women are unaware they have fibroids. So fibroids can be a silent reproductive health issue. And I watched a video yesterday, which I wish we could watch today, but it was too long. That's why I didn't add it to this show, but it was so interesting. It was an American girl telling her story of having fibroids because she had it for many years, but she had no symptoms. And her mother also had it, so it was quite interesting. So women who do have symptoms, which is 1 in 3, may experience heavy periods or painful periods, abdominal pains, lower back pain, frequent need to urinate, go to the toilet, constipation, and pain and discomfort during sex. So like I said, they all interrelate. So how it's very confusing, isn't it? To know.
Yeah.
That's why diagnosis, that's why knowledge.
That's a lot of symptoms, to be honest.
But it's the same as what we've been saying about the
others.
others.
Yeah. But with fibroids, the reason why I think with fibroids, when I got diagnosed with fibroids, before, sometimes when you touch your abdomen, like your tummy, you could feel some hard bits sometimes. And depending on where the fibrosis is located, when you said, some people, when they're urinating, they feel pain, because depending on where it's also located, some people, they have it even on top of the bladder or close to the kidney, all this. So depending on where.
So big.
Some people can go big. Yes. Like my fibrosis, the biggest one is 4.2 centimeters at the moment, or probably less. But some people have 6 centimeters, 10. Some of the cases that I've dealt with, I've had 15 centimeters, 10 centimeters, 7, and all sorts. But I do have 7 or 8. I do have multiples, but they're very, very tiny. They've never grown since 2008 that I have fibroids. My fibroids have never grown because of my lifestyle. Fibroids, they feed on certain food you eat.
Yes, that's what I've heard. Yeah, they feed on. So certain things you eat make them grow.
Yes, like red meat.
Right.
First one, red meat, it makes fibroids grow. This is why in Ghana, a lot of the cases I get, I'm going to get rid of my fibroids. They will get rid of the fibroids. The next 2-3 months, the fibroids back again. Because the same person is eating lots of meat. We love meat. And the more meat you eat, sugar, sweet things, fizzy drinks, of course the fibroids will grow. We don't detox enough. If you detox well, you stop eating red meat, you stop eating sugar thing, you will see your fibroids are just shrinking on its own, small. I had a series with some medical professionals last year, the whole 13 weeks on fibroids, some from America, Asia, UK, and it was NOAA series. So they talk about fibroids and how to manage it. And you know what? In the end, even the medical professionals admitted it. Fibroids can only be managed really through a healthy lifestyle. And this is where my people are not listening.
Exactly. We come home and we are eating fufu and peanut soup and chicken and the goat meat. And it doesn't help. You're absolutely true. It's right. Because you can't be eating these foods every single day. It's too fatty.
Even Ghanaian food itself, African food itself, it should be a delicacy.
That's why the community suffer from fibroids a lot. It's way too much. As you said, the body needs to detox sometimes. So, for example, it doesn't say I don't eat fufu. I do eat fufu maybe once every 2 weeks. Maybe one Sunday, and then I have it. And maybe the whole week I probably have a little rice, some plantain, I eat plantain a lot. And then in 2 weeks time, I fancy fufu, then I have one. But having fufu every other day, it is dreadful. Really dreadful for our health.
And the meats, not
exactly.
They won't take a tiny meat. You see them with massive meats.
And it's not even it's the different types. The salt beef. What do they call it? Cholobi or something. Then there's like if you get when you eat okra stew, there's so many different types of meat inside. You're like, wow. There's this meat. That meat.
That's what some call it.
The skin of the cow, the inside, the gizzard. It's all those things.
So you're absolutely right. The diet is really important. The diet is really important. And as you said, obviously, being on a healthy diet will obviously, the fibroids will disappear. Then what's the point going through surgery to take all these fibroids out?
And a lot of people
now and again.
Surgery cure, but surgery don't cure, because almost all of the women that come to me, I'm going to have a surgery to get rid of my fibroids. And I keep telling them, the surgery won't cure. No. And it costs a lot of money, 5,000 cedis, 6,000 cedis. How many
what?
people to get rid of the fibroids in Ghana? The surgery.
For the surgery, really?
It's even more now. I mean, that's a couple of years ago, a year ago, prices I'm giving you. So going to pay that money, and then the fibroids will still come back.
Right.
Because you're not taking care of some, because they don't even have money to go to the hospital. They will then end up in churches and praying to God because their grandmother sitting somewhere is doing it, and the tummy will swell. They will wait till the tummy gets to as if they are 9 months pregnant.
Well, you're just going to move on because time is just moving so quick. Honestly, topic's quite interesting. We're just dwelling on these things. So fibroids do not be treated.
Just to summarize on fibroids. So who gets fibroids? Fibroids are, like we've been talking about, fibroids are common, with around 2 in 3 women developing at least one fibroid at some point in their life. They're mostly women between the ages of 30 and 50. Fibroids develop more frequently in African, Caribbean origin. So, like we discussed, let's say it's very popular amongst Black women, although a lot of Asian women do get it. A lot of Asian women do get fibroids.
Yeah.
But it's very, very common with us as Black women.
Obviously, the Black community.
Yeah, very popular. So women who have children have a lower risk of developing fibroids. So when you've never had children and you have fibroids, it's very dangerous.
Yeah.
It's even more dangerous because it really affects fertility.
Exactly.
A lot of women, like Elizabeth said, they do get fibroids removed. They conceive, and then the fibroids is growing with the pregnancy. Sometimes it grows with the pregnancy, or when they deliver, then the fibroids just come back like
exactly.
Of poor maintenance. And sometimes we can't just say poor maintenance because some women are just unlucky. Some women try, they have a healthy lifestyle. There's people just associate fibroids with being overweight or but
no, it's about your diet, the intake in your body. It's about what goes into you, basically. It's not about your weight. It would be good if you can obviously exercise, and exercising, having that physical exercise and looking after your diet, but then it's not just because, you're overweight or anything. No. The intake is the cause, and that could, again, it's not being treated.
It's hereditary. A lot.
Yes.
Fibroids is also hereditary.
Yeah.
It's something that if your mother has it, your grandmother had it, it's a hereditary thing as well. So sometimes you could be healthy and whatever, but it could be
having fibroids. This is what we have to understand. A lot of women have fibroids, but as you remember, you mentioned that not every woman have the symptoms of it. So having fibroids is not the issue. The issue is how it's affecting your life. And when it starts to affect your life, this is where you need to do something about it. So it's not about just having it, because anyone can have it. But then how do you live with it?
That's another thing. So living with it, you need to think about, obviously, your health. Are you going to have children in future? Have you had your kids? Then you think about your diet. So it's a whole package that you need to think about.
And even the surgery can also damage your womb. Some of the surgeries that women have to get rid of the fibroids, sometimes the medical professional might mistakenly damage the womb. That is also going to lead to infertility issues.
Exactly. And my take from this will be basically, your diet. To be quite honest, that'll be my take on it. And obviously, a bit of exercise, looking after yourself. And obviously, there are medications depending of the type of, the fibroids you've got to help them shrink them. So again, you refer to the GP, obviously, how you can treat your fibroids. But then again, the education is there. You just need to take care of yourself and obviously your diet, basically. Right.
Yes.
So are we moving on to the videos right now, or we got time?
Not just yet. So I just wanted to overview like what we spoke about. So we spoke about endometriosis today, didn't we? We spoke about PCOS. And fibroids. we've had a little bit of an overview, spoken about the signs and symptoms, which we've realized they all interrelate.
Yeah.
They're quite similar, but I think with PCOS, it's the hair, isn't it?
Yes.
Excess
hair growth, yeah.
And with
And
the
can put you on weight.
So with endometriosis, what's the main sign like that you can think of that separates it from the other?
More the painful menstrual periods, irregular periods. So the pain.
The pain
is extreme.
Okay, and then with fibroids.
Fibroids could be some of them the tummy grow, feeling nausea. So it depends on the woman. Everyone have their own kind of symptoms.
Okay, so so we've spoken about the three main ones that affect women from the BAME community, and like I said in the beginning, there's a lot of different reproductive health issues that affect us. So maybe another day we can talk about, you know, another set, and you know, even with men, that's a topic that I was speaking to Jacqui about, talking about, because reproductive health conditions don't only affect women, they affect men.
Yes.
And infertility as well.
Yeah, exactly. We'll try and get a gentleman in to talk to us about.
That's what we're trying to work on, getting a man in and a doctor so we can talk about, because I think with the women, we always talk about it. It's easy for us to talk about it and use our examples, but men suffer in silence. It's quite, you know, for men, it's embarrassing for them to say they have erectile dysfunction or they have problems with their prostate, you know, like, and all these. For men, it's not easy to talk about these things, but it's happening in our community.
It is.
A lot of people are suffering in silence, so it's something we really talk about. So Elizabeth, thank you for coming on. I just want to ask you a few questions, because people that have joined us maybe throughout the show, you've said you've got this, and they're probably thinking, what are you talking about? So can you tell us exactly what reproductive health issues you have?
So I do have uterine which is having 2 wombs, 2 cervices, 2 vaginal canals. I also have stage 4 endometriosis. I also have uterine fibroids, and I also secondary infertility at the moment, and adhesion, because my organs are down.
And you have, how many children do you have?
1. I successfully have 1.
You've got 1 child. So we thank God you've got 1 child.
Thank you. Amen.
So we had Elizabeth on before. She spoke about herself, and if you get an opportunity to read her book, I mean, you'll find out about everything. She's going to let you know where you can get that. So how do you manage all these conditions?
Yeah, as I mentioned before or earlier during the conversation, to me, it's the healthy, you know, eating a healthy lifestyle. You know, having the right diet, knowing what is good for you, what is not good for you, trying bits and crops, and also knowing certain remedies like essential oils, you know, or even herbal remedies, which ones work for you, some supplements, because I do take kind of, regulated food supplement, but you have to be careful what supplements you take. And when I say essential oils, could be clearly sage, or ginger oil, or lavender oil, it's very costly to be, you know, because it costs a lot of money. And also taking care of myself mentally, as you know, feeding myself with positive thoughts, affirmations, and all of that. So it's a whole kind of, you know, changing your life, your lifestyle, and everything. But that's how I take it.
Having all these issues yourself is what led you to become a reproductive health advocate.
Yes, to me, it was an eye-opener for me to realize that women or young girls shouldn't go through what I went through. They shouldn't suffer in silence. And doctors need to listen. They need to be aware of these conditions. And they can only listen if someone like me come out and say that, why did you neglect me? So do not neglect a sister as well. So this is the reason why I also decided to advocate.
And we spoke about mental health challenges, and we spoke about mental health. You know, this show is based on well-being, but we really focus on mental health. So how do you deal with the challenges you face mentally? Like, I mean, you spoke about being positive and all this kind of stuff, but for some people it's not that easy. You know, it's not just you have like you have a purpose. What about the women that don't really have a purpose? How before you found your purpose, how was you before you found your purpose?
Well, I'm not going to lie. I've had my fair share of depression and anxiety. And I have had it. I will not be hypocrite or pretend that it's not there. And someone will say yes, even for the anxiety. Someone will say yes. The fact that I woke up and having it with I know I am high risk to kidney. I know I'm high risk to other reproductive. I know I'm high risk to issues. That is an anxiety when it's all issues. But an anxiety where I deal with it is seeking help. It took me many years. I did not get I did not get till 2020, and that is not normal. You know, I kept quiet. I suffered inside. I kept, and I separately understand women. And it's not easy to open up. It's not easy to admit, especially coming from East Africa. It's not easy to admit that you have a mental health issue. And that was what I was going through. I felt, and that was what I was going. I've got so many things going on. I don't want so to know that I'm not okay mentally, but this have effects on mentally. This have pain, the trauma, the pain hospitals are dramas. Even if men can tell you, even the diagnosis, men can father they have to understand and accept the fact that they have whatever that diagnosis is. And the way they can deal with it is seeking the way they can deal with the right of professional, the right of relationship, the right to speak to people, when you find people that will listen to people, friends and people that will listen, that will not judge, friends and compassion, that will not find a spouse or a partner, find that one understand what a partner, that one understand what it's not just about you, having it's not just about you, all kind of like all kind of like everyone around them, everyone around them, that understand what you're going through. Jacqui go into this. Jacqui go into quite a lot of groups and advice.
Elizabeth has gone through it, Elizabeth has gone through it actually. So contact your GP, one experiencing of those, experiencing any of those point of contact. And obviously there are support groups, and obviously there are obviously with your GP, it's not just the consistent. It's not always anytime you feel ill, always anytime you feel ill, go to GP, exactly. GP, family, obviously going to family, doctors, sometimes it's quite difficult. Sometimes it's quite difficult. Come close, people and talk to people about what you're actually talk to people about what you're actually people are quite sensitive. Some people are quite sensitive. Foundation, sometimes it's difficult. You don't want to go out there. You've got people like you don't want to go out there. So you can come people like you. They come to you because obviously you. They come to you because obviously those always experiencing. Those always here. Because you've got our team there. Your book and is it about your book? Is it about you or about your health? Tell us about your health.
So the unspoken identity, the woman. So the unspoken identity is about my life, but it's my life. Yes, it's about my life. It's covering all these diagnoses, covering all these diagnoses. How I persisted the doctors.
So it's about your health then?
Yeah, I would say just my health is my journey from as young as the age of 6 years old, as a child. What was going through my mind? So what I was thinking. Why was I feeling I was different? And how I persisted and try to find answers. So, and also everything that was going on in my life, rest of my life, not just health, as from childhood to teenager, adulthood, being able to conceive.
It's about your journey, about your life.
And a lot of women can relate to it. A lot. So not only reproductive health, even having a premature baby. The things we go through. So it's quite intense. And I know a lot of people think, because it's the woman with vagina, not only that. So it's
not about that. It's about your experience going through, obviously, all the challenges that you had to face as a child and now as a mother. Just your journey. Right. Where can we find this book? And how much is it?
So on Amazon, Amazon is one of them. At the moment, there is sales, but normally it's $9.99. It's
$9.99. Okay.
Waterstones, WH Smith, eBay. It's on many,
it's everywhere.
Yeah. So just Google
everywhere online, on Amazon, on WH Smith.
It depends which country you are. Just Google
Okay.
Mistaken Identity
On
by Elizabeth
eBay.
Amoaa, and you will
Okay.
just,
Right.
purchase the copy.
So I think I'll be waiting for my copy. So I need to order one online so I can read.
You can access it through British Library. You can read it for free.
I can read it for free. Okay.
On the British
So I know
Library.
it's out, but I haven't got a chance to read it.
Some
So
of the
I will read
libraries
it.
you can access it for free.
Okay. Right. Okay. So now we've got the your website is specialladyawareness.com.
Mhm.
Did I get it right? So
Yes.
it's www.specialladyawareness.com. And this
Yeah.
is Elizabeth's website. If you want to find out more about her journey, more about her experience, more about her challenges, her life, just visit, browse the website. You'll find everything
Or
about
even
her.
on Facebook, Special Lady Awareness on an Instagram.
You're on Instagram, but you haven't got your Instagram details.
Oh,
So we can get everything on your website.
SpecialLadyAwareness.com.
Sorry?
On Instagram, it's at Special Lady Awareness.
Okay. Instagram is at Special Lady Awareness. And are you on Twitter?
Yeah, that one is more personal. But
Okay.
my
What about Facebook?
It's Special Lady Awareness.
Special Lady Awareness on Facebook and at Special Lady on Instagram. All right. Fabulous. Well, nice meeting you. Good to see you again. And thank you so much about obviously the insights about PCOS, fibroids, and as the other one, endometriosis.
Thank you, doctor.
I know. I said to Eva today, we are going to be the medical experts this evening. I was so looking forward to today. It's been really good talking to you again. And thank you so much for obviously accepting the invitation. As usual, your bestie brought you on. Anyway, guys, put a video on for us.
Yeah. I think the first one should be about.
Hi, I'm Dr. Mary Mellencon, Medical Director of the Washington Women's Wellness Center here at MedStar Washington Hospital Center. A uterine fibroid is a benign tumor that grows within or near the uterus. It's quite prevalent. Up to 80% of women will have a diagnosis of uterine fibroids throughout their lifetime. Most fibroids are detected on clinical examination, so fortunately for most women, they are asymptomatic, but fibroids can cause lots of issues, most common being bleeding. It's the most common reason for a problem office visit to the gynecologist or provider. Fibroids can differ in size, ranging from the size of a pea or apple seed to watermelons. It's unusual to be able to determine the degree of symptomatology based on the size, because the pea-sized fibroid, if it's located in a strategic position, will cause excessive bleeding versus the larger watermelon-sized fibroid, which may have a patient present with no symptoms at all. There is no exact cause for uterine fibroids. We do believe it's multifactorial, and it can involve environmental exposures. We believe there's a genetic component to it, so we tend to see fibroids that run in families. We think there's a growth factor component to it as well. Exercise, we believe women that are more sedentary tend to have more fibroids. Diet, women who consume a diet that's higher in animal products, dairy products, tend to have more fibroids, but we really don't know the real root cause of what causes fibroids. The biggest risk factor is being of reproductive age. Fibroids tend to affect women prior to the menopause because in the menopause, they tend to stop growing. So symptoms of fibroids could include things such as bleeding, pressure symptoms such as the fibroid pressing on the urinary bladder, so women tend to have to urinate frequently. There can be some issues with fertility depending on where the fibroids are located. That could cause women to have difficulty conceiving or cause problems during pregnancy. All fibroids do not need treatment. We tend to treat fibroids or intervene with medical or surgical management if the woman is symptomatic. Again, 80% of women having fibroids, that's a large amount of women that we would be treating unnecessarily. So women that have symptoms are the women that we tend to treat. Fibroids are usually diagnosed on a clinical examination. During a routine physical examination, the provider may detect that the uterus is larger than normal. And if that is the case, then the patient will likely be sent for some sort of imaging study, most common being a pelvic ultrasound, to determine the number, size, location of the fibroids. My patient care philosophy is treat each patient individually where you meet them. If they're totally asymptomatic, we're going to take that watchful waiting approach. If a patient is symptomatic, then I know that I can improve her quality of life, whether it be with a medical approach, procedural approach, or surgical intervention. That's how I approach each patient individually.
Period pain should not be debilitating. Period. If someone tells you that your really bad cramps are normal, don't believe them. You could have endometriosis. Endometriosis happens when tissue similar to the lining of your uterus goes rogue and grows in places it doesn't belong, like on your ovaries, fallopian tubes, or intestine. And because so many people just live with the pain, it takes an average of 6 to 10 years for a person suffering from endometriosis to actually be diagnosed with the condition. That's a long time to wait for an explanation. Here are 5 warning signs or red flags that tell you something definitely not normal is going on. Number 1, intense period pain. Really bad cramps are a classic symptom of endometriosis. We're talking pain that makes you miss school or work, or pain that doesn't go away with birth control pills or anti-inflammatory medications like ibuprofen. Not all people with endometriosis have this much pain with their periods, and not all people with bad cramps have endometriosis. But really bad pain anytime is certainly something you should talk to your healthcare provider about. Number 2, chronic pelvic pain. If you have severe pain in your pelvis all the time, not just when you have your period, you may be experiencing the effects of inflammation and scarring caused by endometriosis that has been left untreated. The longer this cycle continues without treatment, the higher likelihood your pelvic floor muscles and nerves may also be negatively impacted. Number 3, painful sex. If having sex hurts, that could be a sign of endometriosis. Penetration can pull and stretch endometrial tissue that has grown behind the vagina or lower uterus. Endometriosis can also lead to pelvic floor spasm, which can worsen with vaginal penetration. Some people experience only a mild discomfort, while others experience a deeper, more intense ache during or after sex. Basically, if the pain outweighs the pleasure, something isn't right. Number 4, stomach problems. When endometriosis attaches to your bowel or causes kinking of your bowel from adhesions, it can wreak havoc with your digestive system, causing nausea, constipation, or diarrhea. It can also make you severely bloated, especially when that time of the month rolls around. Number 5, trouble getting pregnant. If you've been trying to get pregnant but aren't having any luck, endometriosis might be the culprit. And you're not alone. Up to 50% of women who experience infertility have endometriosis. Endometriosis causes inflammation and scarring in your pelvis. The scarring can also cause kinks in your fallopian tubes. This inflammation, scarring, and kinking make it much harder for the sperm and egg to meet up, or for an embryo to implant in your uterus. Endometriosis is a frustrating condition. Many people have symptoms, but some don't. Some people have mild pain. For others, the pain is unbearable. And for so many people, the road to diagnosis is an unnecessarily long one. If you're experiencing any red flags at all, it's important to see your healthcare provider right away. And remember, bad period pain isn't normal. Having regular appointments with your healthcare provider is key to staying on top of any potential problems or concerns.
awareness, and Elizabeth Amoaa's book, which is Unspoken Identity, touches greatly on some of the health issues that women face and also the challenges they face regarding access to healthcare. And this really touches it. And as part of my promotion in terms of healthcare provision and health education, it's trying to ensure that people understand health. People are aware of their health. People know what to do at what time and whom to go to.
The author is my mother. She's my mentor. She's my everything. I love her so much. So being here is being here for her. And then also sharing in her dream of empowering young people to stand up for themselves. The girl all over the world to have a voice for herself. This is a dream that we both share, and we hope to see a world where love would be spread through our voice, because we are capable.
It's so important as a woman to support another woman, especially when it comes to what she's going through. I can actually relate to her story, health-wise, what women will go through. And I think it's so amazing for her to actually come out to speak.
It's true that coming from an African background, it is not easy to come out and share my story globally as a woman born with 2 wombs, 2 cervixes, 2 vaginal canals, and other reproductive health disorders. However, I believe it always takes one person to use their life challenges and experience to inspire others and also encourage them to seek early diagnosis and the right medical care they need. The Unspoken Identity, The Woman with 2 Vaginas, yes, it was authored by myself. The book narrates the long health journey on how I discovered that I was born with a different anatomy, which is having 2 wombs, 2 cervixes, and 2 vaginal canals. The Unspoken Identity book teaches women and young girls on how to love themselves, appreciate their differences, and stand up against labeling, stigma, and also ridicule. Take this opportunity to say thank you to so many dignitaries that turn up. It starts from Ghana Health Services, UNFPA, the Office of the President, some of the representatives came, also the Office of Secretariat Scholarship, also to all the volunteers, to everyone that came, and to all the people that donated, so much money. It's so amazing. It was so shocking, the fundraising, all the 5 fabulous painting that they went. I couldn't believe some were donating as much as over 10,000 cedis. This shows that, there needs to be funding that needs to be put into reproductive health. And I thank all my amazing speakers, Dr. Pina Monapo, Dr. Vanessa, Anesi, and even myself. We are so grateful that the book has been launched. The Unspoken Identity, The Woman with 2 Vaginas, has been launched, and it has been so impactful. Thank you to Ghana. Thank you to everyone that came today. And I must say, God bless you all.